Hi, Jana.
Hi, Erica. Hi, Black Sheep Nurse.
Full disclosure for everyone, Jana and I were just talking. We've known each other for 12 years.
12 beautiful years.
It's been a long, crazy ride. And the reason I wanted to have her on, we met when we were both ER nurses at Washington Hospital Center long ago. And I noticed her as an ER nurse, but I also got to know her as a sexual assault nurse because that ER at the time, housed that program. And now she owns French Forensics. And French Forensics is a forensic nursing education consulting company. And they offer, well, not they, it's just Jana. She offers online and live courses. And starting this summer, she's going to be holding a hybrid 2-day clinical skills lab for forensic clinicians. So, in honor of Sexual Assault Awareness Month, I wanted to have her on and talk about one, what our company does, but just what does a sexual assault nurse do? And if you're interested in that, you'll get all kinds of good information. But before we go there, Jana, where are you from? Tell us.
Oh, Erica. I am from originally Seattle, born and raised. Left, went to college, nursing school at Azusa Pacific University in Azusa, California.
Yeah.
Got my bachelor's there, my BSN there. Promptly moved to Washington, D.C. because they were the only place that was hiring new grads in the emergency department because at the time, that was 2005. Emergency departments didn't love new grads in them.
I don't know if they do now, but they have to do what they have to do.
Yeah, they just staffing is staffing. So they had sort of a pilot program going for new grads in the emergency department. So they accepted 3 of us at the time. And I'm convinced the only reason I got the job is I was in the middle of my critical care rotation, which was just horrendous. And I was thinking, I've hated every rotation I've done. What am I going to do with my life? Because, like, I don't know how I'm going to be a nurse. And critical care sure wasn't it. And I wasn't, flourishing in that class either. Um, so they asked me all these clinical questions like on the spot at Dream Day. It was called Dream Day
Dream Day.
at like this HR event.
Oh, that is precious.
I know Dream Day. I was
Yeah.
like, wow, there's some branding there. Um, anyways, so I knew all these, questions about ICU critical care type things. And they were like, oh my gosh, you're a perfect fit for this. And I was like, am I? I sure. Okay, I'm in. So I basically accepted my job at Dream Day. And then didn't look back. So I moved to DC and I was there for 14 years. And then I know who can live in DC for 14 years.
Not me.
Not me. Not me. I mean, it was fun. Actually, it's really fun living in DC and not being political. It's a fun city from that perspective.
Well, what people
Anyhow,
don't know, I do think it's worth it to highlight. When people think of DC, they think Capitol Hill. And spoiler alert, that's about 1% of what that city is. It's a very, very diverse population. It's also highly dangerous. And it's just, it is not Capitol Hill. Stop thinking that. Do not think that. But anyway, go ahead.
yeah, no, that's a good PSA announcement in general for families visiting DC for the glorious, mandatory Washington DC trip in
The
middle school.
obligatory family vacation that you
Yeah.
have young.
Also, don't do that family vacation in the summer. It's so hot and swampy there.
Yeah, try not to. Try to do it during your fall break. It's much more beautiful.
Much more.
Fewer people.
Um, but okay, so there for 14 years. What was the question? Where did? Oh,
So you came to you started in the ER.
oh yeah. So started in the ER. Got baptism by fire big time. I mean, it was like the best place for me to be. Like it was a very supportive of my ADD. I could like co-manage a zillion patients at once. I was surrounded by people that also had very, very, you know, challenge. Sorry. Um,
You want to pause? Okay.
so started working in the emergency department as a new grad. They trained us up for, I think, 18 weeks, which now I'm like, was that too long? Was that too short? I don't know. Total baptism by fire. Loved working in the ED, thankfully, because as I said, I was in my senior year of nursing school and was like, I have hated every rotation. I don't know what I'm going to do with my life.
I'm so glad you're
And
saying that because I feel like people are like, oh, that's sort of unpopular. You should love every second. That's not required. It's okay. You can still be a nurse. There's a place for you.
yeah, yeah. And I think you may even like, I just happen to find it in the ED. But like it may take a couple shots, like trying some different departments out and specialties out.
Yeah.
And like the time, so 2005, like all the nursing professors were like, you go to med surg for 2 years to like earn your stripes, whatever. And then you go pick a specialty. And I was like, if I have to go to med surg, God bless those nurses that are med surg, career med surg nurses, because we need them. But if I go to med surg, this will kill my soul. I can't do this.
Yes.
So anyhow, fortunately I didn't have to, but it was like, I had so many professors in the field that were like, you go to med surg first. And I think they've definitely like come away from that, right? Like that's not what they're pushing anymore. But, yeah, if you are I mean, we're talking spring break of my senior year, I interviewed and I was like, this is not for me. I don't know what I'm going to do. Sure. I was applying to like adolescent psych, med surg.
Lord.
Mean, like I was all over the place. And just thinking I'm going to hate all of these, but love the ED, great spot, but keep searching. Also, I'm gonna be really candid. School is a struggle for me, a big struggle for me. So, I, I think I graduated with like a 2.9 GPA, which I'm not even sure you can graduate with that now. I think they have laws maybe against that.
There's laws.
There should be, maybe not, but
Not in
I really, really struggled. And I am always very candid when I talk to like student nurses about that. I'm like, yo, I struggled and I'm fine. Like, I'm fine. I found my place. It took time. You're going to find your place. But I did. I struggled. I have some pretty aggressive ADD. So, like, just trying to manage that in nursing school was a challenge, and trying to figure out how to find, especially in nursing, that like played well to that.
Yeah.
Also important. So anyways, that was totally an aside, a different kind of public service announcement. But for any nursing students or newer nurses that are like, what am I doing with my life? It's all right. Let's just find something else. Like there's other options.
It's okay. So, don't lose hope.
It's okay. And if you have a 2.9, get it up to what you need to get it up to graduate. But like, no one's going to give a flying rip what your GPA is past your first initial interview. I'm not even sure if they ask that anymore, but
yeah.
Anyways,
yourself in the ER.
Found myself in the ER.
How did you get into forensic nursing?
Sure. 2 years in, I was like, this is getting kind of, I don't know if boring was the right word, but I was feeling comfortable because our ED was never boring. It's just never a dull moment in that ED. But I was like, I really was kind of looking for something to add to my skill set. And I saw there was a WAN ad, like old school WAN ad with the pull off paper thing.
Oh, like in the nursing lounge and you pull off the phone number?
Yeah. Oh. I'm not even sure there's a website because I feel like we were barely like websiting anything at that point. But so I pulled it off, and they were hosting a training course, and they were hiring to work for forensic nurses, for sexual assault nurse examiners. So I must have emailed that person. I don't know. Took the course, and we'll talk about like what a course and all that looks like in a few minutes. And then started practicing on call. I was on call for the emergency department as a sexual assault nurse examiner. And then I sat 2 years later, you sit for, or two, somewhere between, well, you don't necessarily even have to sit for the exam, but I did sit for the certifying exam, which is similar to like a CCRN or a CEN. I sat for that exam and became a certified sexual assault nurse examiner, adolescent and adult examiner in 2010, maybe about there.
So
So
it's been a couple years.
it's been a minute, and if I were going to court, I would know the answers to those. But it's been a minute since I've been to court, so I don't have to reflect back on the historical documents to see when I graduated and when I did all these things. Um, okay, so that was, I got that. So then sexual assault nurse examiner, and then eventually over time moved up kind of in the leadership role within the program, and then was one of the support. Started the sexual assault nurse examiner program as a nonprofit separate entity within Washington, D.C. for adult and adolescents in Washington, D.C. that had experienced sexual violence.
I think this is a good time to ask because
Mhm.
I've had a couple of episodes before now where we talk about forensic nursing, sexual assault nursing, and it's still a little nebulous. A sexual assault nurse examiner, I guess they're still called examiners, but a sexual assault nurse examiner, what does she do?
Sure. That's a great question because I get phone calls about this or emails about this almost weekly from someone trying to figure it out, trying to figure out if it's a good fit for them. So, a sexual, first of all, there's kind of this umbrella. It's the forensic nursing umbrella. Under that umbrella, we have things like nurse coroners, nurse death investigators. We have sexual assault nurse examiners. We have nurse examiners that work specifically in like domestic violence or intimate partner violence clinics. We have, in some cases, forensic nurses or sexual assault nurse examiners have been brought into mass casualty situations just because of the training in the background that they have. Also, in community crisis situations, because we have specialized medical training on how to really handle patients that are in a traumatic crisis. Think about like your crisis mental health providers. We kind of can play in that role, but in the medical realm, like when you have patients that have medical needs addressed, we're going to hopefully not re traumatize them, but also complement any other kind of mental health services that might be there at the same time. So under that umbrella of forensic nursing is sexual assault nurse examiners. Also, there are programs that deal with there are nurses that deal with elder abuse, that treat patients of elder abuse and participate with like adult protective services type situations, the documenting, examining of those kinds of patients. Just kind of more generalized victims of violence, patients of violence. In your larger hospitals, you have forensic nurses documenting, seeing those patients because it is a separate entity of nursing. It's an additional training to nursing.
Okay. And then sexual assault nursing certainly falls under forensic
Yes,
nursing.
it does.
And I feel
SANES.
like
You often hear people call us SANES, which I hate that acronym, but here we are.
I
SANES. Are
say it all
you
the time.
nurse? Yeah. So SANES, that's what they hear us. It's a bit of an interchangeable term. I interchange it a fair amount too, but a SANE nurse. You also have medical, like NPs, PAs, and physicians that are sexual assault examiners.
Oh,
They maybe they don't have a certifying course like we do, but they maybe have taken the 40-hour training course, have an advanced skill set in caring for patients that have been victims of violence, sexual violence, etc.
okay. Because I feel like most people, and maybe even nurses as well, their knowledge of the sexual assault process is from Law and Order SVU.
Yep.
And you might see the patient slash victim in the ER, and there's a nurse around, and then it's immediately to the detectives, which that's fine. It's a show. It's a show called Law and Order, but that little piece of the nurse that you see is a much broader part of the picture. So tell us what a sexual assault nurse does.
Sure. First and foremost, our concern, our goal is to make sure that the patient feels safe, that they feel in control, and they feel informed about the choices that they're able to make. depending on, we won't get into like, is the patient reporting, not reporting, all of these things, but depending on how the patient got from sexual assault to a sane nurse, a medical facility, there can have been that is, there's a wide variety of what could have happened in that time frame. So once they get to us, the very first thing, I go in after introducing myself to the patient and I just say, I'm so glad that you're here and that you're safe. And I want to help you to continue to make you feel safe. Do you feel safe right now? Because, first of all, we, of course, want the patient to get medical care. We want to help them make an informed choice about receiving medical care and prophylactic care and all of those things. But a patient cannot do that in a way that makes them feel like they're in control if they don't feel safe first. So we really want them we want to make sure that they feel safe first. And then we talk to them about all their options. Now it's awesome because they have kind of this, I call it the a la carte options. They have all these options they can choose from. They can choose one, they can choose all. There was a time when you kind of had to agree to do everything in order to receive any services at all. We've gone away from that in the last decade, which is awesome. So we really want to make sure that the patients feel safe and that we can then help them make informed choices about how they want their care to go from there.
Okay. And then they feel safe. What do
Mhm.
you do then? You conduct an exam?
We do. So, generally speaking, there are a couple components to an exam. Of course, the first part is always consenting and asking the patient, you know, sharing with them all of their options, which can be very overwhelming, especially if you're kind of in that post flight, fight, freeze, the trauma responses going on in the brain, right? Which that could be a whole other podcast in and of itself. But so, really making sure that the patient understands, like, here are your options. Do you want to continue? If the patient's reported to police, clarifying, I know that the police brought you in here today. I want to make sure you're still comfortable with me sharing your the exam findings, the photographs, whatever else with law enforcement. Is that still something you want to do? Because they may not have been given in that option. Hopefully they have been, but we want to re-clarify and reconsent to every part of the process as we go. Then we do a really detailed past medical history, right? Because I'm a nurse. I need to know, are you on blood thinners? Are you on antidepressants? Like, this all impacts the care I'm going to provide as a nurse, and particularly as a sane nurse. So we do a really detailed history. Then we do a really detailed head to toe exam. Let me be clear. And like, I want to like turn up the mic volume here. As a sexual assault nurse examiner, we are not glorified swab gatherers. We are there to do a head to toe, detailed head to toe nursing assessment of that patient. If we are not using our nurse background, our nurse skills, our nurse knowledge in the care for that patient, we have no business being there under the guise of a sexual assault nurse examiner. We need to be providing medical care. And there are programs that exist where they basically don't go in and ask any medical questions. It's just the nurse that goes in and swabs away. That is not the appropriate role for a sexual assault nurse examiner in this case. We
Okay.
need to be providing very thorough nursing assessments, health assessments, a very thorough head to toe exam. We may or may not take photographs of those injuries, always talking to the patient about those options. Recording, doing very detailed injury documentation, and then, of course, providing the patient with any prophylactic medical medications, whether it be HIV, post-exposure HIV meds, STI meds, pregnancy prophylaxis, whatever that looks like, mental health resources, those sorts of things. And then, of course, if the case does go to court, and a majority of these cases, 2% or less, ever see any time in court,
Mm.
we will testify on our exam, which is why we need to be doing nursing documentation with that, because the only reason why our information is allowed into court is because it is entered into court in the medical hearsay exception,
Oh
which
gosh.
again could be a whole other podcast, but
There's so many. So
so
maybe we'll
many.
do that in November for
Maybe
Forensic
we
Nurse
just need
Month.
a series.
We probably should. So, okay, not to break it down, but we'll break it down even further. So you
Yeah.
see the patient in either a hospital setting or some other setting where
Mhm.
they've come
Community
from
clinic.
a clinic or
Mhm.
um, some other sort of scenario, you do your
It
head to
could be
toe assessment. I'm sorry, go ahead.
sorry.
Yeah, where all can you get exams? The hospital?
A lot. It really depends on the location. There are places that have community-based clinics. There are places that go to the emergency department. There are programs in emergency departments. There are mobile programs where they'll go basically anywhere a patient presents. They'll go to them, assuming they have an agreement with that facility. They're in correctional facilities, in the correctional health facilities. They can be um, they're on military bases. Military bases are also given the option to come off the military base to the civilian side of things. So they're in a lot of different places. In rural communities, they may respond to their local emergency department, and then they'll telehealth a forensic nurse examiner like myself in to help guide that exam, to collaborate with the local provider to make sure that the patient, despite being in a rural community, still has access to all the services that they would in a more urban community.
Okay, I
So
think that's
lots of
important to
options.
highlight because I think most people don't know, and it's so varied across the nation.
Mhm.
It is not the same everywhere. That's why I tell my friends, I'm like, if something ever happens to you or your loved ones, call me. I
Yeah.
will find out where you need to go and what you need to do. But anyway, so let's assume, just for simplicity's sake, that someone has come into the hospital and they have a program, and the nurse does their head to toe assessment, gives them education, medications, resources, and also does the swabs and the photos and that sort of thing. If the patient opts for law enforcement involvement, um, talk a little bit about how we work with them. Well, it's not we anymore. Sexual assault nurses. How do sexual assault nurses work with law enforcement and
Sure.
maintain the chain of custody and that sort of thing?
Yep. So on the front of, uh, so yes, we work with law enforcement. If the patient is wanting to report, we work with law enforcement in the same way you would collaborate with EMS when they bring in a patient, whatever that might be. So we would make sure there's a sexual assault nursing or a forensic, excuse me, there is a kit um, that it's an evidence collection kit is generally what it's called. And that is kind of, it used to be called like the rape kit, the sexual assault kit. Like those are like terms obviously I don't love, but that is what I'm referring to here. So that kit is what we collect all our swabs, and we put all of the potential biological evidence off of the patient, everything that we've swabbed, we put them into that kit, and that kit gets turned over to law enforcement, and then law enforcement turns it over to the crime lab. Generally speaking, this is how it goes. Little different depending on where you are and things like that, but crime lab will then process the kit. They'll process each swab, see if there's evidence present on the swabs, see if there's DNA present on the swabs, etc., and kind of go from there. That is how we interact with law enforcement.
Okay.
We help maintain that chain of custody. So obviously, like once I collect that evidence, I close and seal the kit. I sign on there that I've been holding this. I am now turning it over to officer such and officer such and such is going to take it to the crime lab, and then the crime lab will sign. So we do participate, like while we are not law enforcement, we do participate in maintaining that chain of custody just to ensure that that kid is allowed to be processed and there aren't going to be issues with the quality of evidence. Because back in the day, kids would get thrown out all the time because there was no chain of custody and they sat at the nursing station for weeks on end. So that's kind of how we work with law enforcement. At times, law enforcement will call and they'll say, "Hey, can you explain to me what this means?" Because they'll get the chart in a lot of programs. They don't necessarily get the photographs, which is great. I do not support the releasing of photographs immediately to law enforcement. I think that needs to be a separate subpoena process.
Hmm.
But I don't think we should just be turning over specifically genital photos to law enforcement without a separate subpoena and having everyone really understand what that means, because we have a trauma diagram related to genitalia and we can draw very clearly on that, like that is sufficient for everyone's needs for the most part. We don't just need all these genital photos out in the world.
That's a good point, because the detective does not need that to
Mm-mm.
investigate to go get this perpetrator.
No.
Maybe the prosecutor will,
Yeah.
if it comes to that, but
Well, in a
detective.
lot of programs, they just I've heard this because I train all over the country. They just turn them over to law enforcement, either print them out or put them on a CD. And I always challenge those programs to really think through that process. And like, do they need that? Because I would argue that they don't need that at this point in the game. Certainly, maybe down the road, absolutely. But like, I'm not just comfortable with releasing these photos into the world.
I get that.
Yeah. But,
Okay.
so, anyways,
Yeah.
all that to say, um, we will call, law enforcement would call. They would call when I was more in a leadership role of the program. They'd call and they'd just be like, "Can you clarify what this means on a chart from a very clinical level? Um, talk me through, what is an abrasion? What is an abrasion? Like, or they'd just be like, what does this mean on the chart? I don't know." So there's kind of from an educational perspective, we would educate them because they're not the medical professional. Just like I would ask them questions about how they went about an investigation, not necessarily related to a patient, but it's interesting to know so that you understand how your role fits into the piece of this larger puzzle.
Right.
So
And so you turn over, okay, you do your assessment, you provide resources, you provide education, you do the kit, you turn it over in some capacity.
some capacity, yeah.
After that, you already touched on it. Sometimes, if it goes to trial, which unfortunately it sounds like it's very rare,
Very rare.
but if it does, you can be called. Is that
Mhm.
accurate? Okay.
It is accurate. And actually, before we talk about that really quick, I would just like to say, oftentimes, I know this from prosecutors, defense attorneys, etc., that I've worked with over the years. They will use, people are like, well, it doesn't go to court. They don't even use my record. That's like a frustration I hear with the newer nurses, right? Trying to figure out like, what's our bar for success? Because we should probably put a pin in that and talk about like the bar for success in a few minutes. But um, they will use, like, let's say the case never sees a day in court, but there are legal proceedings, there's plea bargaining, etc. They will bring the forensic nurse record, the sane nurse record in, and they will say they had an expert forensic nurse, sane nurse there who documented all these injuries, saw the patient, collected evidence, and that will be used in kind of the plea bargaining process.
Mhm.
So just, I always like to clarify, like, we may not see time in court, but that our records can be used for that, um, for helping in the plea bargaining process. So yeah, but if a case does go to court, they will call the forensic nurse that saw the patient and possibly as both a fact and or expert witness, to testify on the case. This does not happen a lot. Nurses tell me all the time, I'm afraid to be a sane nurse because I don't want to testify in court. If that's your fear, call me. Let's talk about it because I'm going to change your mind. That's not a reason. If you are called to do this and you feel like you really want to do this and you're passionate about doing this, well, you're not going to. It is very rare that you're going to spend any time in court because no one's prosecuting these cases very heavily,
Yeah.
which is unfortunate. But like, if that's your barrier, let's talk through it because there's ways that you can be coached through that. You can be prepped for court, that sort of thing.
That's,
Um,
I'm glad you said that.
yeah,
A
it's
lot of
important.
nurses, they want to help patients, but they're like, I don't want to get involved in the nonsense and lawyers scare me. That's how they feel.
Exactly,
Yeah.
exactly, and that's valid. Like that's a
Right.
completely valid fear, but feelings are also wrong sometimes.
Right. Let's talk through it. Let's
Yeah,
get you prepared because the way to combat fear and anxiety about just a small piece of the pie is with education and a plan. So if
yep,
that's the only thing holding you back, but you really feel passionate about this patient population, we can talk about it.
yep.
There's ways to mitigate that.
Absolutely. And it's still gonna be scary, right?
Yep.
I'm still nervous when I go to court.
Yeah.
I don't do it all that often. But as I said, not a reason to not get into this field.
Okay. Well, thank you. I feel like nurses will have a better understanding of what is the sexual assault nurse actually doing. So that kind of leads me into your company. So you used to do the actual exams. Are you still doing that? You now have a consulting and education company. What have you transitioned to?
Yeah. So I still really love, well, I should say briefly, we should pause for a moment or talk about the master's program.
Okay, so before going on to your company and what you're doing now,
Yeah.
and we have nurses that are like, wow, that sounds really cool. That sounds like something that I would want to help with. How do I get involved? What is required? Is there an educational requirement, an experience requirement?
That's a great question. Again, something I get phone calls and emails about all the time. In a lot of states, you do not need any additional training, which is sad. It's
Oh,
a
so
special.
not even sexual assault training.
No, no.
Oh,
A lot of states are that way. There's nothing officially mandated. It
okay.
is getting better. So, as always, I would say check your state. If you need help finding that out, email me and we can sort it out. But ask around a bit, see what's like popping in your area, how this is happening wherever you are. But um, I would tell you, why don't you want that extra education? Because you should want it if you're going to do this. So, if
Right.
you, yeah, um, I just part of me thinks like, yeah, you need to know what you're doing, like so that you feel confident and you're doing the best you can do, providing the exams that you provide for these patients. So,
Oh,
first thing first, it's the 40-hour didactic course is what it is called. It is now like anywhere, depending on what one you take, between like 41 and 47 hours, I think. But it's generally a 40-hour didactic course. There are other lookalikes. Be cautious. There are some 2-hour, 4-hour, 6-hour, 8-hour courses. Those are not the courses that you need. You need that's a great place to start, but like if you're paying for it, or maybe some places their hospitals offer it for free or their communities offer it, that's a great place to start. But like if you are a nurse and you're going to be practicing with this population, you need to take a 40-hour-ish course.
so
Probably
where
the
would they go to find out if this course is legitimate and would count as quote unquote education?
Sure. So you want to go, I generally send folks to the International Association of Forensic Nurses, or IAFN, forensicnurses.org. And there is there's under education, it's the 40-hour SANE A course. They also have a pediatric course. I don't practice in the peds world, but the pediatric course is there as well. It's an online course. Occasionally, I still hear of like physical, like in person courses being offered, or Zoom versions of the courses offered. Like I know DC Forensic Nurse Examiners offers Zoom, live ish Zoom versions of those courses. So there's a couple different ways you can do it, but you can go to IAFN. Any course that you do, I would just make sure there's an IAFN seal of approval. It looks like a little seal stamp thing, or ask them, like, has this gone through the approvership process of the IFN? Because subsequently, if you decide in a few years, you don't need to, but if you decide that you want to sit for the sexual assault nurse examiner certification test,
Mhm.
you need to have a course that hit all the educational guidelines for that, and not all courses are built equally.
Okay, that makes
So
sense. But to even do this, say you're going to apply to a program, are they looking for an associate's, bachelor's, master's?
it
Nothing?
it really just there's no a lot of programs say a bachelor's degree. I wasn't necessarily wed to that in my program that I helped run. But you just need to have a nursing license. And then a lot of programs will either say you need to have taken that 40-hour course before you apply to work for us. Some programs maybe have their own homegrown 40-hour course. So that's why I said check and see what's happening in your community, because there may be a free one coming up. Um, again, make sure it fits those guidelines that IFN puts out, but that seal of approval. But yeah, you can have associates, bachelors. I will say specifically, do not get sold into the master's in forensic nursing, and that you have to do that in order to do this course. In fact, I'm going to be very frank with my opinion on this. You do not need a master's degree to practice in this field. And I think that unfortunately, because people aren't informed before they think they need a master's degree to do that, but it's like this anywhere in nursing, right? A lot of people think you got to have a master's degree to do this. You do not need to go get your master's in forensic nursing. Absolutely not. In fact, I would tell you, get some street cred, figure out, like, do some exams, decide if you actually want to get a master's degree in forensic nursing, and then cool, do that. But don't just do that out of the gates. And a lot of those master's degree programs will offer the same 40-hour course within the program. I wouldn't do those. Generally speaking, a sane online course is going to run you $350 to $500 if you have to pay for it. Start there before you get any more advanced education. I mean, if you have all the money in the world and you want to do that, great. But I feel very badly for people that kind of get sucked down into the MSN pathway in forensic nursing, thinking they have to do this to be a sexual assault nurse examiner to do what they want to do in this field.
I think
No.
that's so important because if you want to do that, great, do it. But you do not have to do it to practice as a sexual assault nurse.
No, you
Okay.
do not. And
Okay.
I would tell I taught before for those programs. Um, the students that did the best got the most out of it. I think in nursing, there's been such a push to get a master's, get a doctorate, get a PhD.
Mhm.
And I am not that way. I don't personally feel that way. I think that you absolutely go on to do those things if you want to, and B, if you can financially do it without sinking yourself. But get some get some real life skills experience, because that is going to make your advanced education so much richer than
Mhm.
if you're just like going blasting on through all of it. And those are the students that had much more thoughtful papers. They had cooler capstone projects. They figured out how to do really useful things for their same program that they worked for, like
Yeah.
really useful toolkits and, like quality assurance or quality improvement projects. Those were the nurses that really made that master's degree useful to them. But you're not necessarily going to get paid better because you have an advanced degree in um, forensic nursing. So
Okay.
I'm a big believer in just do the work first and then decide if you want to get that degree on
Okay.
top of it.
And
Mhm.
then in order to become a sane nurse, or you have to do the 40 hours, you have to be a registered nurse. Do programs want to see that you have a certain amount of experience as a basic nurse?
Most programs say that you have to be a nurse for a year
Okay.
before they want to take you on. I would just say, in general, I probably agree with that. You need to just figure out how to be a nurse first and, just learn how to do those nominal tasks, because we still do those as a sexual assault nurse examiner.
Well, and
Um,
especially that head to toe assessment. Yeah.
that's huge. That's
Yeah.
huge. And not the focused assessment that like we do in the emergency departments, right? Because
Right.
I could do all those all day long. I had to like go back and go back to like health assessment 101 in nursing school and be like, what's a brewy? I mean, I did know a brewy, but you understand what I'm saying. Like, you
Yeah.
have to go back and readdress those skills, because in the ED, we just did focus assessments for the most part.
Right.
Um, so keep that in mind. And then, was there something else?
No, a
Yes.
year.
Oh, a year of experience, generally speaking, a year of experience. And then you just need to be able to work. We work fairly autonomously. So
Yeah.
you got to be comfortable with that because you don't have anyone in there holding your hand. You may be fortunate enough to have a preceptor or some precepted experiences if you get hired on by a SANE program, but
Mhm.
that varies greatly depending on resources and the community that you're in.
Yeah.
So that leads up to the clinical training that you need, that you should want. It is not mandatory.
So the IAFN has a 40-hour program, and I know you have your forensic nurse education consulting company. Are you offering that 40-hour program, or what do you
Right.
do? What does your company do?
There's days I'm like, what don't we do? um, And I should be really clear, French forensics is me. But I do have a lot of really great contractors that work for me too. I love that I get to choose who I collaborate with. I get to choose the person that has really like that loves teaching this, and they help me develop
Mhm.
what French forensics puts out into the world for education. Um, our focus primarily is
Yeah.
really, really solid, useful. I mean, like literally, that's the most boring word, but I want useful clinical education, because I got so much nonsense education that did not actually help me in the field of being a sexual assault nurse examiner. So everything we put out on French forensics, I put out as French forensics is like clinically, is this freaking clinically useful? Because if it's not, I don't want it on the website. I don't want to offer it. And have I gotten requests for it?
Right.
Because that's the other thing. People will call me and they'll say, we need, for example, I have anoscopy for forensic nurses. So that's an anoscope inserted into the rectum of a patient. Some programs do this, some don't. It just depends on a whole variety of things, but there was a program that needed that. And so I built that education out for them. And subsequently, other programs have ended up using that education as well, because there's nothing online that exists like it. I'm number 5 when I Google forensics and anoscopy. I
Anoscopes.
know,
Anoscopes, you find Jana.
you will.
Google anoscopes and you
Things
will
I
find
never thought I'd
Jana.
be so excited about. Um,
So for these, for so a lot of these programs will have these 40-hour courses, but your company offers more specialized courses that maybe you
Absolutely.
didn't get in that
Absolutely.
big,
There's
broad
plenty of
40-hour course. Okay. So what are
the
some examples
anoscope,
of what you have
that's
to
Old
offer? The
Faithful.
anoscope?
We do a lot
Okay.
of photography training, clinical forensic photography training. We don't have an online course for that quite yet. It's
Okay.
complicated to put online for a variety of reasons, but we do a lot of clinical photography training. I team up with a professional photographer to do that as well. We have there's a bundle that's getting launched soon called FN Essentials, so Forensic Nurse Essentials. That is a package that's being launched that is really being geared towards the brand newbie nurses that are in forensics that are like, how do I swab? How do I do a really detailed strangulation assessment? It's really like the nitty gritty of like, what do I need to know to get this done? What are the things I should be totally freaked out and need to go get an advanced provider for, or get different, some sort of other resource involved. So FNE Essentials is launching pretty soon, and that's going to be a bundle of a whole bunch of different courses, including anogenital evaluation. So it is simulated exams where I am showing you a penis, a scrotum. We talk about how to swab those things, like actually show you how to swab those parts of the body. We have the genital exam for the female patient. That's going to be launching pretty soon as well, and that is like a detailed genital exam for a vagina, for a patient with a vagina. And there's no other place that you can get that kind of detailed, quick. This is what you need for the clinical environment. Like I'm really real
And
humans,
we're using
real not
real
just
humans,
what do
not
they
just
call that? Those
this
mannequins that
a
oh,
mannequin.
I don't know that Noelle is one of the
Oh,
mannequins. No, in fact, I don't own any mannequins. I do at times really need them for like social media, because you can't show vaginas and penises on social media without getting all kinds of things flagged, all flagged.
flag, this is unsafe, and you're like,
So I
yeah,
can't do that,
I
but
know. So
yeah, so it's real live courses with real live humans, and we are doing those. We also, so that's pretty much on my website for on frenchforensics.com. I have an online learning center for on demand learning. So you can do that at your own pace. They'll spit out a
Ooh.
continuing ed certificate for you. Um,
Then don't you have
yeah,
journal club?
Oh, we have Journal Club.
Yeah,
Thanks. You're like plugging it for
yeah.
me. We do. We have Journal Club. We're on our second year of that. And that's been really a great way to help. We have What's awesome is Journal Club is like the great equalizer. We have brand new, fresh baby sane nurses and super experienced and kind of everything between from all over the country.
And what is it? What is
And
journal club?
yeah. So we send out a journal, we post a journal article with a worksheet. And I mean, like when I tell you I am not a researcher, I am not a PhDer. This worksheet talks me through the whole article. Like who are the key players? What was the background of this research article? And then we have you kind of read the article, obviously ahead of time. That's on your honor. Use a worksheet if it's helpful for you. And then we sit for an hour over Zoom. It's also recorded. And we talk about the article. We talk about why it's useful or not useful in our practice, how we might eventually have to testify using or maybe we don't want to use this article. We talk about that, and we talk about overall clinical applicability and like where is more research needed, in a very casual, extremely supportive environment. There's no we don't have any nonsense. It is just very much like, come as you are. We're going to help you learn this. Um, I have a colleague of mine, Dr. Jocelyn Anderson. She leads that more because she is a PhD and a researcher and wants to share her love with all of that with folks. I think you're going to have her on the
Yes,
podcast
she'll be in
eventually.
a couple of weeks.
Yeah. Yep. So we do Journal Club, and that's an annual membership. And that has been really helpful. And we've gotten a lot of great feedback about that.
Jana, thank you coming on today. I really appreciate it. Where can people find you?
Instagram. I am on Instagram. That is it. Maybe debuting to TikTok soon, but for now, Instagram at French Forensics, French like the language, French Forensics. And then if folks are wanting to look at courses that we offer, look at FrenchForensics.com. Lots of courses there under my courses and kind of upcoming training options. And then if they have any questions, feel free to email me directly at FrenchForensics@gmail.com. I'm happy to help answer or kind of, I spend a lot of time just kind of fielding questions and trying to help nurses figure out how to get involved in the field. And I love it. So please email me there. And if for some reason I don't get back to you, bug me again, please. I don't want to miss you.
Yeah. Or bug me. I'll bug her. How's that?
That's great.
Thank you for coming on.
I'm so honored to.